Hello, and welcome to this webinar on the care of children with Down syndrome. This webinar is a collaboration with Baylor College of Medicine, our Department of Molecular and Human Genetics, and Texas Children's Hospital with Genetic Services in Houston, Texas. We are working in collaboration with the University of Texas, Texas Center for Disability Studies, thanks to funding from the Department of State Health Services. So our webinar today, we're really excited to tell you, will be by Dr. Carlos Bacino. Dr. Bacino is a professor in the Department of Molecular and Human Genetics here at Baylor, and he's also the Chief of Genetic Services at Texas Children's Hospital. So please welcome Dr. Carlos Bacino.
Hi everyone. Today I would like to talk about Down syndrome, but I would like to be a bit more practical about what needs to be done with children or individuals that have Down syndrome. I'm a clinical geneticist at Baylor College of Medicine and have practiced clinical genetics for over 25 years. So I have my share of patients with Down syndrome in the past. What I would like to do is just give you some introduction so you can get familiar, but I would like to spend more time in the things that we need to do or things that we need to watch for. So Down syndrome is a condition that we have known for many years. It's a common chromosome problem, and in fact up to 1 in 800 live births, we can see children that are born with Down syndrome. So it's the most common chromosome condition that we know, and that's why we see a lot of children with this condition, and we have learned a lot over the past decades. So how does it happen? Well, normally you need to have 2 chromosomes 21, but in this particular case you had 3 chromosomes. So, and that happens in about 95% of the cases. There's a small percentage of cases, about 5%, that you end up having what is called as a translocation, and there is a name for that called Robertsonian translocation. So what are the chromosomes? Well, the chromosomes are the structures that are inside our cells. In every single one of our cells, we have the chromosomes that are packed within each cell in a place called the nucleus, which is the inside pocket of the cell. In those chromosomes, we have thousands and thousands of genes, and those are the single genetic instructions. And those genes will ultimately be converted in something called proteins, which are important for our bodies. And there are, again, thousands of those proteins. So what happens in trisomy 21? Well, in trisomy 21, as you see in this picture, and if you look at the arrow, it's showing you that there are 3 small structures, and those are chromosome 21. Normally there should be 2 of those, but in this particular situation, there are 3 of those chromosomes. So in this particular picture, you are seeing the chromosome study of a boy that has an extra chromosome 21. If you look at the picture, you will see that all of the chromosomes from 1 all the way to 22 have 2 chromosomes, which is normal number, because we typically get 1 chromosome from our mothers and the other chromosome from our fathers. In this particular situation, the 21 group has an extra chromosome instead of having 2, and that is what ultimately causes Down syndrome. You have a lot of additional extra material that packs a number of genetic instructions, and that causes Down syndrome. This is a picture of something a little bit special, which happens in only a small percentage of patients with Down syndrome, and that is called a translocation form of Down syndrome. So if you look at the arrow that is pointing to a chromosome that it says number 14, you see that there are two chromosomes, one on the left that is a normal chromosome 14, but on the right the chromosome 14 has something stuck on the top, and that's an additional chromosome 21. And if you then look at the 21s, that they are typically what you will see with two chromosomes 21 in single state. But this is a type of situation where you have this extra chromosome 21 on top of another chromosome, in this particular case chromosome 14, and that leads to the translocation form of Down syndrome. Now, this type of situation needs to be look into it, because sometimes the mother may actually have a form of these without having Downs, but can have something that is called a balanced translocation. So if that is the case, we need to study the parents, and in case one of them has this type of situation, which may lead to having more children with Down syndrome in future children. So you probably wonder, well, what happens if I have a child with Down syndrome? Well, is this something that is going to cause all of your children to have Down syndrome? And the answer to that is no. That's something that I hear all the time. And the reality is that most of the families who had a child with Down syndrome do not have another one with Down syndrome. So it's only estimated to be 1%. So if I have 100 people that have a child with Down syndrome, only one of those 100 will have another child that has Down syndrome. So 99% or 99 of those couples will not have a child with Down syndrome, so they will have a regular healthy child. Of course, if you have a translocation, that may be a different story, because you can have that in the mother or in the father. If it's in the father, usually it's a low risk, it's up to 1%, but in the mother could be as high as 7%. There is an exception to the rule, which is an unusual form of translocation that involves two chromosomes 21 stuck together. And in this particular case, the risk could be as high as 100%. So that's why it's very important to visit a geneticist and to get an appropriate test once a child is diagnosed with Down syndrome or trisomy 21. Again, Down syndrome and trisomy 21 are the same thing, and that we have a tendency to call it either way. So what happens in Down syndrome? Down syndrome children, like is shown in this particular case, they're very cute kids. There's absolutely nothing wrong in their appearance. They have some issues that makes us suspicious of this condition, because there may be some differences in the way the face look, and typically the muscle tone is a bit more poor. The head tends to be smaller and flat in the back part. The ears could be small, and sometimes you see what is called upslanting palpebral features, which means the outer part of the eye sort of moves upwards. And in some cases you can see in the corner of the eye something that is called an epicanthal fall, which is almost like a skin tag. The mid part of the face tends to be a little bit more flat, and it's not uncommon to see the tongue sticking out, and that often is related to the decreased muscle tone in the facial area. The neck tends to be short, and sometimes there could be some skin falls. The hands could be short, and they can show something that is called a single crease that I will show you in a minute. And there is some shape of the fifth finger in the hand that is called in medical terms clinodactyly. In addition, sometimes you can find sort of a wider gap between the first and the second toes. This is a child that has Down syndrome. You can see on the top and on the bottom left what is called a single transverse palmar crease, and that's because the palm tends to be a little bit shorter, and then it doesn't move as much, and then you see only one single crease. That's nothing abnormal about it. It's just a sign that we use in medicine to help with the diagnosis. In the bottom right, you have an increased distance between the first and the second toe, which is also a typical finding. What about the clinical features that are more inside the patients of Down syndrome? Well, I would probably like to highlight a few common in Down syndrome is the congenital heart defect, and that needs to be assessed and addressed for every single child with Down syndrome, because sometimes it could be silent, so may not have a murmur, may not show much of an issue. So all of these children need something that is called an echocardiogram. Heart problems can be seen in up to 50% of the patients. The other area of trouble in Down syndrome is the gastrointestinal system. Why is that? Because sometimes there could be a narrowing in the small intestine as starts coming out from the stomach, an area that is called the duodenum, and there could be narrowing that causes something that is known as duodenal atresia. In addition, Hirschsprung's disease can be seen in Down syndrome, and that is caused by lack of nerve cells in the distal parts of the intestine. That's basically what signals when the stools are ready to come out, and if you have issues with that, you may end up with severe constipation. The other issue that needs to be addressed is the possibility of celiac disease. This is a condition that can be seen, and I will explain a little bit later on, in Down syndrome, that is caused by intolerance to gluten. So what other common problems you can end up with? Well, we know that there is an issue with growth. Typically could be because of feeding problems and some of the gastrointestinal issues that I mentioned, including celiac disease, the low muscle tone that needs to be addressed with therapies, delays in development and cognition that could go anywhere from mild to severe, but we tend to see more mild to moderate. And also something you need to remember is that in young adults with Down syndrome, you may have an increased chance for Alzheimer's disease. Other medical problems include the issues with the thyroid gland, something that is known as hypothyroidism, because it doesn't function well, and that can be addressed with appropriate medications, so it's really easy to address. Problems with the blood cells, we will go into that later. Hearing problems, so you need to make sure the hearing is appropriate so you can address, otherwise may cause issues with speech delay. Sleep apnea, which is common also in this condition, often because of the airway and the muscle tone, and as I mentioned to you before, feeding difficulties. So this is actually taken from an article that I probably will recommend all of you to look into it, and is an article that is put out by the American Academy of Pediatrics, and they revise it every few years. The last one was revised in 2011. If you go to Google and you put Down syndrome guidelines, you will get the free PDF that has all of the details. Even though it's written in medical terms, I think that is easy to understand, and you will see what are the issues that need to be addressed in Down syndrome. You can see on the left side you have a list of the common medical problems, hearing, vision problems that happens to be strabismus, cataracts can be seen. Then you have the sleep apnea that we talked a little bit about before, ear infections, congenital heart disease, all the way from thyroid problems to hematological problems, etc., and some of the ones that I also talked before. So if you go to this article, and of course this is not really legible, I apologize, it's not meant to show you in detail what goes on, but actually if you pick up the paper and you look at the PDF file, you will find that there is a very clear explanation of what needs to be looked at and when in the lifespan of an individual that has Down syndrome, from hearing checks to thyroid screens to celiac to sleep apnea, etc. So all of these are very well described, and this is something that can be followed by your pediatrician to make sure that you get all of the regular things that any baby or child or adult will get in a medical exam, but in addition will get the things that are specific for Down syndrome. It's not that complex, and this is something that any good practitioner, nurse practitioner, PCP can do. So now, what do you do in terms of caring for a child that has Down syndrome? Well, one of the things you need to really do besides the medical management is to make sure that you have the right home environment. You do the work with the child, and you have all of the things that are appropriate for educational support and the nourishment in the environment that can help your child with Down syndrome. Early intervention is very, very important. In Texas, as well as many other states in the U.S., there is a program that is called Early Childhood Intervention that will provide physical, occupational, and speech therapy in the early years of life, and that usually is until age 3 years. And then you will be referred to the school district that will take over up until the school age, which is 5 or 6 years, and beyond. So all of that therapy in early intervention and going through education are very, very important to stimulate and get the level of these children and young adults to the maximum, their maximum potential. And of course, when you get to older age, you need to start working on vocational training. Ultimately, you want your child to become a young person, young adult that will be entering in society and that will be useful and fulfill all of the requirements that anyone in society can have, from going to work and having independence. So that's what is vocational training all about. So this is very important because the level of functioning of these children and adolescents could be very dependent on the education and the care of the child. So it has to be done right. At least, you have to get the resources that can help you get to that point. With regards to feeding problems, I mentioned that early on. Children with Down syndrome may have problems with slow feeding or choking with feed. Remember that the muscle tone is a problem, and the muscle tone also relates to the muscles that happen when you swallow. So if you're not swallowing properly, you may end up with getting the food or some of the liquid getting into the lungs or the different pipe that is not going to the stomach, that is going to the lungs, and end up in multiple pneumonias. And that may also manifest in these persistent respiratory problems that are repeated infections. And also, if your child is not growing properly and is unexplained, that may actually be showing that there is an issue with feeding. So an easy test that we do in medicine is look at the swallow test to look at how your child is swallowing, and that is just an X-ray that requires some substance, contrast that is given by mouth to see how that food or liquid is being processed from the mouth all the way to the stomach. The other issue that we checked carefully is the thyroid gland. Why is that? Because we know that up to 18% of people with Down syndrome may have a low functioning thyroid. So typically what happens is that when any child is born, they get a thyroid test, and that usually covers the children until the age of 6 months. Then typically we do the study looking at something that is called TSH, and then look at something that is also known as T4 and T3. So ultimately, when everything checks okay, we continue this testing throughout lifespan, and we do it every 12 months or every year. So remember, then we do it at birth. The doctor will do that for you at 6 months and 12 months, and from then on at 1, 2, 3, 4. So every year you do that. This problem may actually set in later on in life, so it's very important that you detect it, because if you do, you can treat it appropriately. And it's very simple. It's just one small pill a day. What about hearing problems? The issue with some of these kids is that their ear canals may be a little bit different. So typically what any child gets is something that is called a hearing screen, and then typically the screen is done later on in a more formal fashion. So about 50% of the children with Down syndrome may have a fluid inside the ear, and if that is persistent, may cause issues related to hearing, and that will interfere with speech development. So in that particular case, your child may need something that is called as pressure equalization tubes or PE tubes. So for that you need to see an ear, nose and throat specialist, or what we call an ENT doctor. What about the sleep apnea? Sleep apnea is actually very common. Sleep apnea is something that you probably have heard. A lot of people have, especially if you have issues with obesity, other medical problems. It's basically an interruption or pause in breathing during sleep. That can be seen in a lot of conditions that have low muscle tone. Or if you also have large tonsils and obesity, as I said before. The symptoms are common and easy to recognize, and these are snoring, insomnia, nighttime awakening, heavy breathing during sleep, and also you can end up with issues related to daytime sleepiness. at least more than that is normally seen. And also you can have behavioral changes. If the child doesn't sleep well, may actually have a pretty unusual behaviors that may interfere with the with education. So again, about 50% of the children with Down syndrome have that. And if this is very severe, although unlikely to get to that point, but you may have risk of causing heart disease. So that needs to be looked at. And what you do when, in this case, when you suspect these issue with sleep apnea, then you do a sleep study, which is something that you have to do at the hospital. It has to be ordered by your doctor, and it's basically you get your child tested. How is the oxygen being handled at the time he or she is asleep? So, and if you find there is this problem with sleep apnea, there are a number of things that can be done, including your typical treatment, which is to take the adenoids and some, which is a gland that is just next to or in the behind the nose part of the pharynx, and and also the tonsils, which are those two glands sitting on the throat. If that doesn't resolve the problem, you can use something that is called CPAP therapy, or you can use this breathing mask that is shown here in the picture on the right side. That will keep the airway open and give the oxygen that your child needs to do well. The other condition that I wanted to mention is celiac disease. Celiac disease is something that happens in the commonly in the population, but it's much more common in Down syndrome, and is seen in up to 10%. And this is basically an intolerance that your gut has to something called gluten, which can be found in wheat, barley, and rye. Other things, you can, as you will learn, do not contain gluten, like oat or rice and corn. So, there are alternatives and things that you can do if you have issues related to celiac disease. So, what are the signs? What happens if your child has celiac disease? Well, typically that happens after your child is starting with regular food, so that happens after a year of age. And these can manifest by constipation, chronic diarrhea, problems with growth, or weight loss that it cannot be explained, and oftentimes you may see abdominal swelling, so the belly could be actually very, very enlarged. And this is something that can be easily checked by a study that we do in blood that looks at something that is called transglutaminase, and this is something that will detect about 95% of the children that have celiac disease. That also then requires a confirmation, and this is done through an intestinal biopsy. And the treatment is easy. Basically, you remove the gluten from the diet, and that basically does the trick. So you don't need to do anything else. You just need to learn to deal with a diet that doesn't contain gluten. On the right side, I show you a photograph of what happens when your intestine is normal. In the left, you see all of these sort of protrusions that actually are the areas of the small intestine that absorb all the nutrients. But if you have celiac disease, you may end up with a situation where all of those structures are now completely flat. So you don't have any ability to absorb the nutrients that you need, and you end up with malabsorption for a number of vitamins, folic acid, iron, and a number of different nutrients. So that's very detrimental to your child's health. So now I'm getting to towards the end. One of the things I wanted to mention is about problems with blood cells, so hematological problems. We know that children with Down syndrome have problems with immunity. They sometimes may have something that is called TMD, which is a transient situation where increased number of the white cells. You may end up with forms of blood cancer that is called acute myeloid leukemia or acute lymphoblastic leukemia, but those are rare. So even though I will mention that, just keep in mind that this is not something common that you see in all Down children. So the body has red cells and white cells. The red cells can be sometimes a little bit elevated, especially at birth, and that's something that will go away. The white cells, however, are the ones that are basically dedicated to take care of infections. So the white cells called B cells are the ones who make antibodies, and the white cells, they are called T cells, fight infections directly. So both of these cells do not increase appropriately. So there are problems with T cells and B cells. The good news is that the T cells, as time goes by, they become normal, and by 15 years of age, they are pretty much like any other individuals. But the B cells will still remain low, and that is throughout the lifespan of patients with Down syndrome, and that causes an increased risk for infections. So there is something that we know is called transient myeloproliferative disorder, or TMD. And this is actually not uncommon. It's seen in 10% of newborns with Down syndrome, and clears by most part in 2 or 3 months. But those children had to be followed very carefully, because 20% of them may actually progress later on to have leukemia. So we know which children we need to pay attention to. And one of the things that you should remember is that we do complete blood counts on all of these kids on a regular basis. There appears to be a gene or an instruction within chromosome 21 that is called GATA1, GATA1, that seems to be responsible for these unusual form of leukemia. So one of the things that you need to keep in mind, that in the worst case scenario, if your child develops this rare form of leukemia, this is something that tends to respond very well to chemotherapy. So actually some of these children require a lot of less treatment and than any other person that has leukemia. So you use lower doses, because otherwise you may end up with having complications from therapy, but overall they do respond very well. So if I compare Down syndrome children with normal children, I said yes, Down syndrome children have 20 times to 60 times more probability to have leukemia. But if you look at the Down syndrome children overall, this is only 1 in 200. So just to keep in mind that this is not something that is common, that it happens, but this is something you need to be aware of, and this is not for you to be scared, but to be able to understand and be able to seek for the right care of information. The good news is that the pediatric hematologists or hematologists in general are very familiar with these medical problems in children and individuals with Down syndrome, and they know exactly how to deal with it and how to care for it. In my career, I had followed a lot of children with Down syndrome, and only 2 that I recall that had leukemia, and both of them were very successfully treated, and they did very well later on in life. So in summary, I wanted to address Down syndrome, and the issue with Down syndrome is the cognitive and the learning problems. So early intervention is a must, and this is something that I say and I repeat all the time because it makes a big difference if a child with Down syndrome gets the right intervention. If you let a child syndrome without proper intervention, that child is going to have more delays and more problems than others. This is something that is well known to us, and we have seen over the years that it is a must. In terms of medical issues, heart, something that needs to be checked early on. The thyroid function, as I said to you before, on yearly checks. The sleep apnea, the issues with the gut, celiac disease and other gastrointestinal problems, and also the constipation with Hirschsprung. The blood cell problems, and also again the developmental and cognitive issues. I think I didn't put in this slide, but also the issues related to hearing and obviously to speech. So I hope that I was able to cover most of the issues that are significant, and hopefully you had learned how to look for these information. So, and this is something that you should get familiar. There are a lot of books out there, a lot of information on the internet that you can get around the issue of Down syndrome. Thank you very much for your attention, and I hope this has been helpful to you all. Bye-bye.
We will send you a short evaluation by email and ask that you complete it. Let us know how you like these video conferences, and also suggest topics that you'd like to hear more about. Thank you very much for joining us today.